Um, I was going to start with this article, and it is outside as a handout. I will be sending it to the other sites very soon. So I did not get it to you for this. And instead of reading it, because that's going to take some time, I'm going to move on to other parts that I want to present, because this really is a great example. I would really encourage you to read this article. I mean, this is the perspective of and I really want to thank Dr. Hong to allowing me to use this article as a reference to explain a part of cultural competency that many times you just don't see. It's much more than language. Okay, well, that's one of the bottom lines. There's many aspects that are going on in different cultures that are causing what we call health disparities. Okay, those gaps in the healthcare system between those who may receive efficient and effective health care and those who don't. And why do those occur? And we're still trying to figure that out. But Dr. Hong talks about, what does it really mean to be culturally competent? Why is it important? Racial and ethnic disparities in healthcare persist despite how much of an effort we make not to have them there. Minority populations suffer disproportionate numbers of healthcare conditions. The rates are higher, especially in diabetes and cardiovascular disease. These are often left unanswered, why this happens in the healthcare system. So, you need to have well-established ways of communicating with patients, for example, on a higher level that brings out that patient satisfaction. And that's something that I hear a lot about when I talk to healthcare professionals. People want to be on that level where that patient understands where they're coming from, so that they can talk to you about the kinds of things that are important to them. But again, it is much more than language. Cultural influences affect a patient's health beliefs, their practices, and their attitudes towards health care. That's huge. Achieving that understanding, particularly in a population as culturally diverse as what we see here in the United States, is a huge challenge. And basically, I'm paraphrasing what Dr. Hong is talking about. And she was a third-year medical student. Right now, she's a resident doing a residency in pediatrics. Here she was doing rotation in OB-GYN. She had done many works. She spoke Spanish, and so she felt that she could talk to Spanish patients. She had a Vietnamese patient come in who couldn't talk to anybody, did not know the language or the customs. She came and she was asked to please take care of this patient. And it basically changed how she looks at thinking that she was doing everything that she could do for patients by being able to speak to them in their native language. She realized how important it was to also become aware about their customs and their beliefs, their attitudes, how different words mean different things in different cultures. Okay, very, very basic types of things. And it made her much more aware, and in her words, she feels made her a better doctor. And so I would encourage you to read this article. So I want to move on, and please, this could be an open discussion for a few minutes about cultural competency, because we all have ideas about what it is, but I just want to give an overview about what we think it means. And a lot of this is coming from, as you expected, this dramatic increase in ethnic and minority numbers in the populations in the United States. Here, clinicians are providing healthcare services in multicultural environments. It's not all homogeneous. There's different cultures, traditions, and as I had said, different languages. So as far as definitions, there really is not one definition that's considered a gold standard for cultural competency. I have one that I do like that's not listed here by the Seattle-King County Department of Public Health. Cultural competency is the ability of individuals and systems to respond respectively and effectively to people of all cultures, classes, races, ethnic backgrounds, and religions in a manner that recognizes, affirms, and values the cultural differences and similarities and the worth of individuals, families, and communities, and protects and preserves the dignity of each. I think that that covers quite a bit. It's huge, and and to take each part of that would take a whole course in itself. And there are, as you probably are aware, there are many courses that just teach how to deal with different cultures and the importance of different cultures. But the term does embody knowledge, attitudes, skills, and procedures and protocols that allows all individuals within the system to render services across the differences in culture in a way that is efficient and optimal. At least that's the goal. There are many other related terms to cultural competency. Some people call it as biculturalism. Many people don't consider themselves to be of one culture. I am a first-generation Italian. All right? I am Caucasian. I don't really speak Italian. Many people wonder why I don't. I sometimes would like to know why I don't, but I was never taught. But I'm also a New Yorker, living in the South. A whole conglomeration of different cultures tearing at me, basically. Cross-cultural, you see a lot, maybe within marriage, for example, interaction between individuals from different cultures. Culture itself is a huge thing to try and define. Shared values, norms, traditions, customs, arts, history, folklore, and institutions of a group of people that makes up basically who they are day after day. We hear a lot about cultural diversity, when people strive in certain organizations to have diversity within there so that they feel it is open. And I hear you have differences in race, ethnicity, language, nationality, or religion as a part of looking at different diverse groups. Differences between ethnicity and race have always been confusing for people. Ethnicity is basically belonging to a common group with shared heritage. This may be linked by race, nationality, and as well as language. Race, on the other hand, is a socially defined population that is derived from distinguishable physical characteristics that are genetically determined. I'm just, real briefly, there's several stages that one goes through to become culturally competent. One of the first is really just understand your own. Okay, understand your own culture and your own background. And that helps you open up to the cultures of others, in theory. Secondly, you want to acknowledge the patient's different culture, value systems, beliefs, and their behaviors. This brings you on their level as well to the types of things that are important to them that will make a difference in terms of how well you communicate, how those barriers between the cultures are let down, and that you can openly have communication. Third, recognizing that cultural differences is not synonymous with cultural inferiority. All right? Being from a different culture and that may be as a minority does not translate into inferiority. Learning about a patient's culture, all right, is crucial for healthcare, and adapting optimal healthcare delivery to an acceptable cultural framework. I'm not exactly sure what that framework is. That's something that I feel that is within the context of health disparities is being looked at and trying to be determined. I looked for it, and I really couldn't find anything that has specific cultural framework. And we're really trying to understand what that really means. Now, there's many ways of looking at differences within culture. Many do deal with differences in language, and I said that there are certain words, but also certain concepts within culture that are different in terms of how they're interpreted. The value of time in terms of patient care is huge. Participants and healthcare staff that may really differ in how they value time. They may, the staff may be on a schedule. The patient in different cultures may not have any idea what it could be like to be on a schedule. All right, to come to an appointment at a certain time may not really get through in terms of how important that could possibly be for the staff. And then they come late, or they don't come at all, and there's all kinds of issues that go on. So many cultures mark time by major events, a birth, death, marriage, and they repeat these through different cycles throughout their life. Many Western cultures mark time in a precise linear system, very different than some other cultures that look at time in terms of great things. Okay. Okay, decisions regarding medical treatment, screening, that might not be decided by any one individual from a certain culture. It may be a group or a family getting together. Need to get the family involved, much maybe possibly in other cultures than others. Some cultures require family gatherings. Talk to everybody in the room, not just that patient. Very important. Decisions regarding medical screening. Okay, so then some cultures put a high degree of need for trust within the personnel, and this respect and authority and the need to be polite. Sometimes that may not be as important, the need to be polite for healthcare providers when they just want to get the job done. Okay, they just got to get in there and figure out what's going on, and you have a culture that has certain things that they need to do, may not be done. Many cultures accord great respect to older adults. This can affect how one is perceived and how well materials or programs are accepted within a community as well. For some cultures, a person is not really defined by a name, but in relation to their parents or their spouse. Okay, they do not have an identity within themselves. Okay. Some cultures do not speak in positive terms about a spouse or about children or about possessions because they feel it really brings unneeded attention and there's also superstition that it also brings bad luck. Okay? Things to think about. That could be a huge barrier to try and get to somebody if they're just thinking, well, what's the problem here? I don't understand. Well, within that culture, what I'm doing could bring bad things to me and my family. Okay. And then, of course, appropriateness of questions to obtain medical history. This is pretty well known, and there's a lot of work on that, how difficult it is to have a uniform set of questions when taking a history of a patient that can be considered appropriate. All right. So there's really a lot of information that we can get from different cultures. But overall, there's a tendency to view groups, such as African Americans, Hispanic, Asians, and older patients, people with special needs, as a focus more on their limitations rather than on the strengths of their culture and their community. Overall, minority populations, they can be generally characterized as not applying to all minorities or all people from a minority group. Within the Hispanic culture, you have Cubans, you have Puerto Ricans, you have Mexican Americans, you have Latinos, people living in Dominican Republic, you have all these, and each one of those has their own culture, their own group, even if they all are grouped in as having Hispanic origins. And there's also much information on minority communities that could be considered accurate because we have a lot left to do to understand. I'd like to finish off by looking at some people. Okay, one of the things I like to, I've switched. I used to I like to collect memorabilia stuff. I'm a collector. I used to collect mugs, mugs that had funny little sayings on them, and I realized it's really hard finding enough mugs to put on a nice shelf that have something to do with aging. I mean, there's a few out there, but I had a better luck collecting books about aging, especially those that have a lot of pictures. Many of you may recognize this book. This is our Faces of Aging book that we have available, and it's photographs taken by our resident photographer, Marilyn Broadwick, who has been working here for a long time. Wonderful pictures. I mean, each one of them tells a story, and and each one of them is so unique. And also, this is a book by Joyce Tennyson called Wise Women. The pictures in this book of women are just beautiful. I mean, their dress, their faces, how they hold their hands. These are all over 65 years of age. And the main person. They may be with younger people. They may be with their family. Beautiful, beautiful pictures. And finally, after 90, Imogene Cunningham. I'm going to put these around if you could take a look at them. Everyone in this book is over 90. And this is from all around the world as well. So, what do I have? I have this woman. What can you tell me about her? Older, African American. Wondering like, well, maybe a little bit of a hard life. Maybe. You know, you could maybe stereotype some things. Turns out she's 92 years old, African American woman, a former school teacher. She's living in a convalescent home, and the way she describes it is when you come here, nobody knows where you are. That's her thoughts on being there at that time. This man, he's Asian, right? Maybe a little frail. Has a very interesting stick that he uses for walking. Like sometimes the dress and little things about the people make a big difference. He's 99 years old. He's from Korea. He owned a dried fruit company, and he's still a very active person within his community. Yeah. This is an unfortunate person who has most likely had an accident. At times it's difficult to tell the gender. All right, I wouldn't have an easy time being able to tell her ethnic or his ethnic background. But what's amazing is that it's a Hispanic woman. She's a noted author of many books, and she just had her book signing just 4 months ago, prior to what happened with her fall. How would you approach her as a health care provider? How could you talk to her about things? You know,
Read poetry.
Read poetry. If you would know that, I mean, she's into books and she probably has quite a bit of poetry background. Exactly.
As Professor thought, never assume anything.
Exactly. Right. And finally, there's this woman on the right. I really like this picture. I love the look on her face. And this is Miss Birdy Hale. She's 88 years old. I love how she describes her philosophy on health. Everyone calls me Miss Birdy. My mother said I looked like a bird when I was born, so that's what they named me. I walk 4 miles a day and drink half a gallon of water. That keeps me healthy. I have no sympathy for people who abuse their health. And you know that's what she's saying. I mean, you could hear her saying that just by looking at the picture. Okay. And there's also, I think that she's as beautiful as the person on her left.
More beautiful.
Right. So finally, I just want to end with, and there's dozens and dozens of examples. I like to try and put a face when we talk about culture and see what we're doing. Try, if you will, at some point to define who you are through your ethnic culture. I think it's always important to keep an eye on it. In your culture, what factors determine your illnesses? All right? Is it, that you breathe in pathogens? Or some people feel if you go to sleep and your hair is wet, you're going to get sick. If your feet are wet when you go to bed, you're going to get sick. I still hear that. So who are considered also the healers or the healthcare providers within that culture? It can be very different than what we may think for each culture. I have a lot of information in your handout. There's tons of things in terms of how to interpret cultures that may be useful in your practices. Take a look if you'd like. Are there any questions?
I have a question regarding this of the questions which you asked during medical interview. Did you find special books which are kind of addressing this? I give example, which I just learned by going to nursing home when I asked the patient if she's depressed, and the answer was, I am not crazy.
Right.
When I talked to her son, I told him, how she was doing and so forth. When you come to her, do you think she's depressed? she's not crazy. It gives me a beautiful example that they think if I use the word depressed, they will think that I assume they are crazy. But to learn that, just by this, she was very unhappy. She wanted to throw me out, from the room because...
The same is true of delirium.
Yeah, she was assaulted.
Yeah.
By this one word, she was assaulted by the question, actually. And my question to you is, did you see any book for doctors, this kind of thing addressing, particularly, culturally, like Black, Caucasian support?
Most of the things that I've seen have a translation of words.
Okay.
Okay. In fact, I could show it to you. It has 2 columns. It has what we think as maybe in the health profession what this word means to us, and how an alternate word to a different culture means the same thing that we wouldn't even think of.
Okay.
Like diabetes.
Okay.
Has a totally different meaning for many cultures. That's blood sugar, bad blood. There's something there, or there's something that just really isn't right with sugar. That's what they associate it with. So I could show you that, if you like. And a lot of times, from what I've read, it's what you don't say that makes it easier to get through. To patients of extreme cultures that are like, well, how do I talk to this person? Let them lead it. I've read that it's just an important thing to listen, see, start it off real slowly, easily, and then let them carry it through. And then you have a better idea of like, okay, well, how do I approach this? Because you may already have an idea of what you would be wanting to say and do, but that could totally change, with somebody that really isn't on that same cultural level. Yes, Sue?
I think also asking someone if they're depressed puts most people on the defensive because it's a mental health, a stigma. And if you go maybe more with, how are your feelings, how are you dealing with your feelings and emotions during this hospital stay or something like that. But just the word itself is the stigma that's associated with it.
Right. A lot of times you would say, are you feeling blue?
I was doing GDS
down.
actually. And after, almost completed, she was already very upset. Then I told her what I'm doing. I'm checking if you are depressed. And this is when she wanted to throw me out of the room. This means that, I didn't invent somehow. I started doing GDS.
Right.
I think that's a really good example.
Yeah.
Because you got the blues and you just feel sad. That's not so threatening. It's frank. Let's see. Okay, does anybody at the other sites have any comments or question regarding cultural competency? Okay, well, we're going to move on. I'm really anxious to get Dr. Marquides up here. I want to be able to give him enough time to talk about older minorities. But thank you, and we're going to move on right now. Okay.